The Affordable Care Act. Valerie Jarrett sent out a tweet last night saying nothing in the Affordable Care Act is requiring any of these changes. And I'd like to see if you could just understand how many of the American public would say, wait a minute, the law itself creates the means by which the administration judges whether an individual insurance policy has changed sufficiently to meet the standards. Meaning if you're after the grandfathering period and something about the coverage changed, then the administration can judge whether or not that qualifies for the grandfathering exemption. So the administration is involved in evaluating whether or not this coverage does or does not meet the standards and whether people have to receive a cancellation notice. Is that not true?
Well, let's be clear. That would be true a year from now or 5 years from now. If an insurer put forward a plan and asked if it met the standards and it did not meet the standards, you know, it didn't provide maternity care or it didn't provide mental health services or it tried to impose annual caps or something like that, the answer would be no, that didn't meet the standards. So the only thing that could be done when the law was written is that
the regulations enforce them, right?
Well, right. And so, but the point that she was making and that I and others made last night and I'm making today is that as written, the law granted a grandfather status to individuals who had insurance on the individual market before the passage of the Affordable Care Act, and kept that insurance and wanted to keep it for as long as they were alive, if the insurer wanted to have them on that plan. But if the insurer last year or the year before or earlier this year told, let's say it's you, that guess what, your plan that you signed up for a year, we're changing.
Has a higher premium or a
reduced benefits or anything.
The administration steps in and says,
the administration
we judge
doesn't
that
step
to be
in.
a
The
significant.
insurance company understands and has understood since the
that to be a
passage.
significant enough change, and so now that's no longer grandfathered. That's the process, is it not?
Well, in terms of the agency here, I think the insurer is making the decision to basically cancel the plan and reissue or offer the individual a new plan with different benefits or different costs. So